Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great video for you on how to simply activate the multifidus muscle in degenerative disc disease by using an anterior pelvic tilt. Hope you enjoy. So if you've seen any of our other videos on degenerative disc disease, you realize that many times degenerative disc disease is irritated when we flex forward or bend forward on the spine, which is associated with bending over and not using the hip joint enough, or when we're slumping, there's an actual forward flexion on the spine that aggravates discs. So one of the key components of any healing exercise program for degenerative disc disease usually entails strengthening the extensor muscles. Those are the muscles that hold us back and prevent that forward flexion. And that entails the calves, the hamstrings, the buttocks, the lower back extensors like the latissimus and the erector spinae, as well as one of these small muscles that stabilize the spine known as the multifidus. We've had a lot of videos on multifidus, but just a quick review in terms of where they are. They're small muscles that come off the sides, the lower sides of each vertebra in our lower back, those center knobs or spinous processes. And they travel down 1 to 5 segments to help hold or stabilize the back so it doesn't flex forward, which is essential for degenerative disc disease. Unfortunately, many people with chronic lower back pain, including degenerative disc disease, have a weakened multifidi. The multifidi muscles atrophy, they shrink down, they become inhibited many times within hours of an acute pain episode, and within days they start to lose their strength, they start to decrease in size, and many times fat replaces muscle in these areas. So one of the things that we want to do with degenerative disc disease is to wake up neurologically or activate these multifidus muscles. And one of the ways we can do that is using an anterior pelvic tilt. Now, an anterior pelvic tilt is where the pubic bone goes lower than the tailbone. That's the motion. Now, many of you who have gone to either the Posturesize or painfreeandfit.com websites and have taken our free body analysis realize that you may have a posterior pelvic tilt where the pubic bone is higher than the tailbone, or an anterior pelvic tilt where the pubic bone is lower than the tailbone. In either case, neutral posture where those two bones are level usually provides the best mechanics for our body. That being said, your unique neutral spine may need a little bit of anterior pelvic tilt or posterior pelvic tilt to keep you out of aggravating your unique spinal condition. But once you learn your neutral spine through those websites and through our other programs that we have there, we can use this exercise to improve the function of our multifidus. And the way we're going to do that is we're going to take our thumbs and we're going to go to the bottom corners, both right and left sides of the vertebra. You can pick any vertebra that you want in the middle on your back. There are 5 of them. And as you cough, you will feel a tension bulging out on each side of those vertebrae. You can also do that at the end of exhalation. If you let all your air out and then exhale some more, you'll feel a little tension. Or by pulling your lower abdomen in, activating your transverse abdominals. That will many times cause your multifidus to bulge out into your thumbs as the muscles contract. Check each one of those vertebrae from the highest right underneath your lower ribs all the way down to your sacrum, which is that bone between your hips. And many times what you will find is on one side or two, you may find a level or two that have a weakness. That multifidus doesn't bulge out as easy into you. So what we're going to do is we're going to use at that level then to wake up the multifidus and to get it to contract a slight anterior pelvic tilt, which is raising or tensing your tailbone upwards. And it's important that you don't want to bend your lower back when you do this. You're simply trying to bend your whole pelvis slightly upwards. It doesn't take a lot of pressure, but just a little. And as you do that, you'll begin to feel a little tension coming out into that multifidus. So this is one of many techniques, we've outlined others on some of our other videos, to help activate the multifidus. So try to bend or tense that tailbone upwards, and many times you'll feel a little tension. Hold that tension against your thumb with the multifidus bulging as you then release the tail. And that's the exercise. Trying to engage it by raising the tail up or tensing it upwards slightly, lowering the pubic bone, and then maintaining that tightness against your thumb as you release that tension back to a neutral state. It'll take practice, but after a while you'll be able to maintain that tension as you release it and keep it on as you tilt back and forth. This is just one of many techniques to activate the multifidus, but it's important in degenerative disc disease because many people, when they bend, when they stoop, when they pull things, they need to emphasize a slight tailbone upwards tension to activate the multifidus and then bend from the hip joints so they keep that lower back in a stable position, avoiding that flexion component or that bending forward component that many times aggravates degenerative disc disease. If you like this video and would like to learn more on multifidus function and lower back exercises for degenerative disc disease, feel free to subscribe to our channel. We got a lot of great videos here. If you'd like to help me share this vital information with others, give me a thumbs up below. Questions or comments, I'll do my best to get back to you. If you're looking for a personalized exercise program to address your degenerative disc disease, we have a great one on the painfreeandfit.com website known as the Fast Track Healing Exercise Program for DDD. It's a great program that shows you self-analysis of your posture and mechanics of your lower back, stretches, conditioning exercises, stabilization exercises, strengthening exercises, how to fit your back into activities like sports and daily activities you enjoy while decreasing your pain. I hope this video on multifidus function with anterior pelvic tilting for degenerative disc disease helps you with your lower back pain.